Rowdy Blue reporting for duty. I'm Gamey Goble's 1-year-old assistant, and if you're new around here, I'm your go-to guide for sniffing out the best healthcare options. All right, folks, settle in and listen up. Today we're talking about your annual Medicare guide and making sense of that sneaky little envelope heading to your mailbox soon. Your ANOC letter. That's your annual notice of changes. Insurance companies love to change the rules on you when you're not looking. But don't worry, I'm here to give you the clear, no-nonsense, independent guide to exactly what's changing, why it matters, and how to stay 3 steps ahead. So, what in the world is this ANOC letter, and why should you care? Starting in late September, if you're on a Medicare Advantage or Part D drug plan, your carrier drops this document in your mailbox. Do not throw it in the trash with the junk mail. This single piece of paper spells out every single change coming to your costs, benefits, and coverage starting January 1st. Checking this letter is your secret weapon. It protects you from ugly surprises and gives you the exact blueprint you need before annual enrollment kicks off on October 15th. By law, your Medicare plan carrier must deliver your ANOC letter by late September, typically by September 30th. Think of the ANOC letter as a side-by-side snapshot, comparing what you pay and receive this year versus what you will pay and receive next year, starting January 1st. Insurance plans are dynamic. They change their doctor networks, copays, drug lists, formularies, and monthly premiums annually. If you don't read this letter, you might walk into your pharmacy or doctor's office in January and face unexpected out-of-pocket expenses. Receiving your ANOC is your signal to start preparing for the annual enrollment period, which runs from October 15th to December 7th. It gives you a head start to decide if you need to stay with your current plan or shop for a better one. When you crack open that letter, you've got to ask yourself 4 big questions right off the bat. Number 1, are my costs changing? Check if your premiums, deductibles, or maximum out-of-pocket limits are sneaking up. Number 2, are my doctors still covered? Make sure your primary docs, specialists, and favorite hospitals are staying in network. Number 3, are my meds still on board? See if your prescriptions got pushed to higher copay tiers or dropped completely. And number 4, did they chop my extra perks? Keep an eye on your dental caps, vision credits, and OTC Flex card dollars. If any of these answers look fishy, it's time to pay attention. Let's talk red flags, the stuff that should make alarm bells ring in your head. First, premium and deductible hikes. If these go up, you're paying more fixed cash out of pocket every single month, whether you visit a doctor or not. Second, prescription tier and rule shifts. If a medication gets reclassified or slapped with prior authorization, get ready for a price shock at the pharmacy counter. Third, provider network drops. If your trusted hospital or family doctor drops out of contract, you could be forced to pay full out-of-network rates or switch doctors. And fourth, chopped supplemental perks. Those dental and OTC credits you loved? Plans can trim those down without blinking. Here's a huge one. Prescription drug changes. Formularies shift every year, and with recent Inflation Reduction Act rules updating out-of-pocket caps, insurance carriers are completely restructuring their copays and drug tiers. Here's your game plan. Write down your exact drug list right now. Names, dosages, how often you take them. Listen to this wild stat. Over 70% of seniors autopilot their Medicare coverage every single year. They don't read the letter, they auto-renew, and then boom! January 1st rolls around and they're hit with massive unexpected bills. Don't be in that 70%. A quick 15-minute review puts you back in the driver's seat. Don't have time? We can help for free. Now that we know what to look for and why it matters, let's discuss your step-by-step action plan for this annual enrollment period. Just follow these 3 simple steps. Step 1. Gather your squad and your scripts. Build a list of your preferred doctors, hospitals, specialists, and exact drug dosages. Step 2. Hit the summary table in your ANOC. Look for that side-by-side, this year versus next year breakdown. It lays out all the price tag differences clear as day. Step 3. Schedule an annual plan review. Between October 15th and December 7th, compare your current plan against all the new options in your zip code to guarantee you're still getting the absolute best deal. Now, the big moment. Do you stay put? Or do you make a move? Keep your plan. If your monthly costs stay steady, your doctors stay strictly in network, and your meds stay on affordable copay tiers. If it ain't broke, don't fix it. Explore new options. If your premiums are climbing, your favorite doctor or hospital is leaving the network, or one of your main prescriptions just became ridiculously expensive. If those red flags pop up, switching plans can save you hundreds or even thousands of dollars. Mark these dates on your calendar in bright red marker. Late September, your ANOC letter arrives. Read it. October 1st to 14th, window shopping time. New plan details become public so you can compare options side by side. October 15th to December 7th, the main event, annual enrollment period, AEP. This is when you lock in your plan for the upcoming year, taking effect January 1st. January 1st to March 31st, Medicare Advantage open enrollment. A second safety net window to tweak or switch your Advantage plan if needed. Got questions? Feeling overwhelmed by all the fine print? Don't stress, we've got your back. Reach out to Jamie at Medicare Insurance Techs for a zero-cost, no-obligation ANOC review. We're proudly BBBA Plus accredited with over 100 5-star reviews, and we're here to do the heavy lifting for you, verifying your doctors, checking your meds, and getting you maximum coverage for every single dollar. Give us a call today at 618-225-7967. Let's get your Medicare locked in right.